What do you think of when you hear the term infant and early childhood mental health? For infants and young children, mental health is the capacity to grow well and love well. Infant and early childhood mental health can also be described as a child's social, emotional, or early relational health. A young child's mental health influences every aspect of their development and shapes their growing brain. The relationships and experiences a child has in the earliest years of life impacts brain chemistry and development in lasting ways. It's hard to think about vulnerable children struggling with mental health needs, but 10 to 16% of young children experience mental health conditions such as depression and anxiety, which is roughly equivalent to the rates for older children and adolescents. The statistics are even higher for infants experiencing trauma or living in poverty. A staggering 22% of infants living below the poverty line experience mental health issues. Without diagnosis and treatment, these conditions can follow babies into adolescence. The tricky part is recognizing the signs a young child gives to let us know there is a mental health need. Their mental health needs present differently than what we think of with adolescents and adults. Babies are small, and so are the cues they give us that there is a mental health concern. A mental health concern in early childhood can look like a baby who doesn't cry because they've learned that doing so doesn't elicit a warm, comforting response from their adult caregivers. It can look like a toddler in foster care who is unable to adapt to their new home and resist all attempts the foster parents make to provide comfort. It can look like the 4-year-old who is expelled from preschool because they've struggled to manage their big feelings and express their frustrations, fears, and confusion by hitting, kicking, and throwing. To support early childhood mental health, we need specially trained professionals who can work with families to promote social, emotional health and deliver therapies and other interventions when appropriate. All professionals serving young children and families have an opportunity to support early childhood mental health. Whether they interact with the child and family in settings like early care and education, or during medical visits with a pediatrician or as a medical professional, a child care provider, a nurse home visitor, a social worker, or a mental health counselor. The good news is that infants are resilient, and with early intervention, they can develop into socially and emotionally healthy adults, even if they had mental health concerns at the beginning of life. At Schema, we are committed to making a meaningful investment. To learn more about infant mental health and how to foster healthy social and emotional development and well-being on a personal or professional level, visit scimha.org.